Hello.
Hello.
Is this Fluffy?
Right, that's her.
Yeah. Okay, wonderful. Hello, Miss Francesca. It's so nice to meet you. My name is Flora. I am a vet tech here at Sunshine Animal Hospital. And I'm just going to kind of go over the inquiry over email that you sent about a non-anesthetic dental procedure for Fluffy here,
Right
okay?
then.
So I'm going to start off with a few questions. So how did you hear about this procedure, and why would you like to go ahead for Fluffy with this?
Well, her breath stinks, and my coworker told me that it's cheaper and that it's the same as if I were to put her under anesthesia for a dental cleaning.
Okay, all right. Well, bad breath may also be a sign that your pet is due for a dental cleaning. Have you noticed any issues with her eating patterns at all? Is she having any trouble eating? Have you had to switch her food recently?
Yes, I was feeding her kibble, but she would spit it out, lick her lips, and then smile at me. So I figured she didn't like that dry food. She is now getting wet canned dog food, which I feed to her with a spoon.
All right, okay. How about the look of her teeth? Have you noticed any discoloration, any concerns at all with just like the look of them overall?
Oh, yes, her smile is well ugly. She looks like a chain smoker. Her teeth have this weird grey, yellowish, hard coating over them, and her gums are bright reds.
All right, well, I would love to have the doctor come in to do a bit of a preoperative exam and decide whether or not Fluffy needs to come in for a dental cleaning. However, I should let you know right away that we do not perform non-anesthetic dental procedures here. It's the policy of our clinic. We do not do any dental procedures with an animal unless they are put under anesthetic.
What? Well, why not? I want her breath to smell better. She doesn't need to go under anesthesia. She is a friendly dog and will cooperate just fine.
I understand. So there are three main reasons why we do not perform the non-anesthetic dental cleanings or procedures here. So the first reason is that we're only able to get the surface level bacteria in a standing dental procedure. So if they're not put under, we can't really fully treat the teeth from any future or ongoing periodontal disease. Number two is that it's very traumatic for the patient. And then number three is that we are unable to take x-rays on an awake patient, which hinders us from not fully understanding what's going on underneath the gum line.
Well, why doesn't it prevent any future issues with her teeth?
Okay, so as far as the cleaning process goes, we cannot get underneath the gum lines when they're awake. So accumulation of bacteria under the gum lines is very serious, and we need to get rid of that to prevent any future periodontal disease. And by the look of Fluffy's gums, they are quite inflamed, which would indicate the start or the process of a periodontal disease. So we would want to get that treated and then prevented for the future.
All right, well, then what about it being traumatic for her? What does that mean? You're just scraping her teeth, not cutting her open.
So it's traumatic for Fluffy because she would have to be restrained for quite a significant amount of time, which just really isn't fair to the animal.
Well, how is it any different from me going to the dentist? I mean, I stay awake for that, and I do just fine.
Yes, I would 100% get what you're saying. However, animals don't have the same awareness as we do. So we walk into a dental office and we know what to expect. We open our mouths, they do their thing, and we're aware of it. However, with animals, unfortunately, there's no way to prepare them or let them know what's going on. So in their heads, they're just thinking, here's a bunch of strangers that are holding me down and they're poking and prying around my mouth for a significant amount of time, and I'm not not comfortable, I don't know what's going on, and I'm scared.
Okay, well, I've never thought about it like that. Well, what about the x-rays, though? Why are those so important?
Yeah, so as far as the x-rays go, if you think of teeth as an iceberg, that's pretty much what they're like. So what's exposed in the teeth really is only a small percentage of what you can see is going on with it. So anything under the gum line is pretty much 2/3 of that tooth, including the root. So it's hard for us to know if there's any issues going on with the roots or anything underneath the gums, any underlying issues with the teeth, if we're just doing the scraping of the part that's exposed. So doing an x-ray helps us to understand the pathology that's going on within the mouth, if we need to do any extractions. So yeah, it's very important.
So what's so great then about this new Kohat dental cleaning with her under anesthesia? What's the difference?
So yeah, so the dental that we do here at Sunshine Clinic is it's called a Kohat. So it stands for Comprehensive Oral Health Examination and Treatment. So we will do a full physical kind of overview exam of the teeth. We will do full mouth radiographs to see if there's any issues going on underneath the gum line. And then we will do some cleaning of the teeth underneath the gums and polishing as well. So Fluffy would go home with any issues removed. If we do need to extract, we will call you and let you know. And then, yeah, her teeth will be clean. Her breath will hopefully be better. We do appreciate you being such a good pet owner, thinking of even considering a dental for Fluffy, because it's important. Oral health is important, and yeah. So would you like to go ahead with the dental and book her in?
Right then, you've convinced me. Thank you for explaining this all to me. I have a much better understanding now. I just would like the best for my Fluffy, as she is my child.
Okay, so how does March 3rd at 9:30 a.m. work for you?
Oh, I suppose I'm free at that date and time.
Okay, wonderful. All right, so we will see Fluffy then. All right, have a wonderful day and call us if you have any questions at all right?
Right then, cheerio.